Good morning, everyone. Welcome to Remote Work Wednesday. I'm not used to saying good morning in conjunction with Remote Work Wednesday because we're on a new time today, 11 a.m. instead of 12 noon. Congratulations to all of you who figured that out and are on with us. Um, Welcome to Remote Work Wednesday on behalf of the K-State Extension Community Vitality Team. I'm Ron Wilson, Director of the Huck Boyd Institute for Rural Development at K-State and part of the Extension Community Vitality Team. Many thanks to Deborah Cole, our State Program Specialist and Program Leader Coordinator in Community Vitality for K-State Extension. The K-State Extension Community Vitality Team has long been interested in the implications of remote and hybrid work for our citizens and communities. And this free Zoom call on the second Wednesday of each month is simply to learn about the opportunities and challenges of remote and hybrid work. So, what about mental health? Is it possible to use remote counseling, or we might call it telemental health or another term, to reach populations which can benefit from such outreach? Our speaker today is going to address these issues. Our friend Sherry LaGrange Aulick is a licensed clinical psychotherapist and a certified telemental health provider who provides both online and in-person counseling sessions. She's going to address making remote connections, positive practices for modern telemental health. Her educational background includes degrees in human development and family life from the University of Kansas and in clinical psychology from Washburn University. She's also trained at the Beck Institute for Suicidality, Depression, and Pain Management. Sherry is an internationally experienced psychotherapist with experience dealing in healing complex trauma, post-traumatic stress disorder, PTSD, depression, anxiety, and other mental health concerns. So, Sherry, we'll turn the floor over to you. Tell us about remote connections and modern telemental health.
Okay, let me share my screen here. And okay, here we go. Well, good morning, everybody, or early afternoon. It's nice to be here today, and I'm always happy to talk about ways that we can facilitate healing, and it's very interesting to be able to talk about how telehealth has let's see, let me push from beginning here. How telehealth has implicated our behavioral health or mental health therapeutic and assessment. And so, yeah, I'll kind of give you an overview of what I'm going to cover today, and I will put a timer on so I can watch the time here too. Um, yeah, and to get started first, I would like to I'll open the floor and kind of hear some opinions on what you think about coming to see a therapist or coming to see a psychologist online, because I always like to get feedback on how people are feeling about this before we go in. And then, according to the American Psychiatric Association, I kind of explored some pros and cons that we found evidence-based, and then I'm sure I can talk off record a little bit on my personal experience as well. I'll talk a little bit about just different modalities on whether you're just want to get an ADHD assessment or whether you want to find out if you have what your diagnosis is or whether you're seeking treatment. And then certainly one of my passions is suicide prevention, and telehealth has had an um, immense impact on being able to reach people in crisis. So I would like to address that. And then I'll take questions at the end. So let me just go ahead and get started. So I don't know if everybody wants to unmute. If you don't have to, I don't want to put pressure on everybody, but I just kind of wanted to ask around and get a feel for the room on how people feel about maybe receiving a diagnosis or having a screening for your mental health online, or receiving individual group or family psychotherapy, or maybe having a psychiatric evaluation even, which is neuropsychological, like what's your IQ, what's your baseline memory, all of these things. What is your full packet of assessments? And also we use telehealth to supervise our trainees, our interns is what I call them. So yeah, so I'll just open up the floor to anybody who wants to share their opinion about this.
Hi, Sherry. Thank you for all that you do. I work with online graduate students who take courses at K-State, and from my experience working with older, just adults, having something online makes these kinds of services, education more accessible to them, where they might not have the time or ability to access these services. So I think it's a great thing. Where traditionally, prior to this role, I may have thought a little otherwise, but it really does help those folks in need.
Yeah, and just to follow up on that, I think COVID turned all of this on its head. Like, if you would have come to me before COVID and said, "Yeah, you can just do the same trauma therapy, like you can use everything and you can just be online," I probably said, "No, we need that human connection. We need to be in person," and that I've completely changed my mind because it works really well. Um, okay, anybody else?
Yeah, I don't know if you can see the chat. I've used remote counseling services through Timely Care, and I have really appreciated accessing it. I think it says really appreciated having access to that service. It was nice to be somewhere I already felt comfortable in my home and turning off the camera when I needed a moment to cry or be emotional. Right, absolutely.
All right. Well, I'm glad that's helped for you to be able to feel comfortable. That's one of the things that people do report that they like to be at home. Um, and also we'll cover that too. Like people cancel less because if you're depressed and you don't want to get up and take a shower, you can have a session with me and literally you can be laying in your bed. And I'm really sad today, and that's the time when you most need your therapist, right? And so yeah, thank you for sharing that. Okay, and now I put the chat on too.
I guess my question would be, is it what's the comfort level if you haven't built a relationship with someone beforehand and you suddenly feel a need.
Oh, how comfortable does it feel? Probably just about as comfortable. I don't think anybody says their first therapy session is comfortable. Like it's one of the hardest things to do is to get through that door and start to talk to someone that you've just met about all these uncomfortable things that you're not talking to anybody with. But as a psychologist, I'm trained on how to do that. And I always promise from the beginning safety and then also the sense of like confidentiality and that and working on stigma too. Because if you think about it, if someone broke their arm, right? Everybody tells them like, go, you better go get that set, you better go to the ER. But if someone says I'm depressed, they're mostly, just get over it. Time will take care of it, or just come on, suck it up, pull yourself up by the bootstraps. And this is especially in rural communities and farming and agriculture and in Kansas too. So and I'll talk to you about one of my clients who wanted to come and see me in secret, right? And so let me see if I can go to the next slide here. So we can talk about the pros. Um, Accessibility, you can't go further than your own house to get somewhere. So, I mean, and especially remote areas, like there, I see people in a lot in Western Kansas and Southwestern Kansas who would have to drive sometimes an hour and a half to 2 hours to get to somebody, right? So it is accessible. And also, if you think about those small towns, they're not going to have the same, they might not have a therapist there that specializes in PTSD or schizophrenia or complex trauma, so that you can get somebody very specialized to, or you might want to do EMDR, you might want to do just psychodynamic therapy, or you may want to choose a therapist that does cognitive behavior therapy like me. So you can get your specialist from home and you have a choice from all over Kansas. And actually, with the Psi Pact, which is new, some therapists are can practice across the whole nation now. My therapist is in Colorado, and it's not really necessarily for accessibility or convenience. Again, convenience addresses the travel times and gas money. Gas is expensive. Internet costs a little bit less. And also people are super busy. So I get a lot of people that can just sort of, I do evening appointments and people really like that. They can go home, they can have dinner, and then they can jump in on a session. And it doesn't take away from their PTO or having to explain to their boss why they have a weekly appointment to see a therapist. So it's just easier too and comfort. a lot of people feel better at home. I don't know. We all have to mask or behave in a certain way when we're going out. So a lot of people report just reducing that initial social anxiety because they're at home. They're in their comfort space. Not that they can't adjust to that if they come in person either. And again, stigma. If you live in a small town and there's only a few therapists and your car's parked in front, everybody knows them. And then you might see them at your church, and then you might see them at the grocery store. And not everybody wants to be hanging out with their therapist all the time. So it's for people. I don't think we need stigma. I think if you should be the same if you broke your arm. Everybody should say if you're not feeling so great, just go see a therapist because we're going to help you get out of something that you can't fix yourself. And I certainly couldn't set a broken arm, but I can work with someone who is really struggling with the will to live, or maybe heartbreak, or maybe past trauma that's coming up, and I can help heal your soul and maybe your broken heart. I agree with this. Like, I have no shows for in person a lot more than people that are at home. It just becomes part of the routine, right? They don't have to get up and go anywhere. There's no flat tire. There's no something going on. So I have a higher no-show rate for people that have to come and see me versus people that are coming online or are attending therapy online. So certainly if somebody's sick, I don't want them to come to therapy at all. But if someone just has like a little bit, they feel like they're coming down with something and they're an in-person client, I can switch them automatically to telehealth, and then I don't risk getting sick and getting everybody else sick too. Um, I think that I put this on. Oh, well, now you know that I didn't use ChatGPT because I made a mistake. I put behavioral activation on the wrong one. That should be going on the cons. Sometimes people who are super isolated, they might need to come and attend in person rather than being online because they just get stuck in their home. For example, if someone had a diagnosis like agoraphobia, which is fear to leave the house, maybe doing online counseling would be helpful at the beginning, but later on we might want to switch into coming in person so that they can get up and get out of the house as part of their therapeutic treatment. So sorry about that. That should go on the other slide. We can just fast forward a little bit. I think this is something that we haven't really proven, but I think that it prevents burnout for therapists. I like to work from home too. If I get a cancellation, I could go and weed my garden. Oh, it really needs it, but or do putter around the house. I could pet my cat. I could take a nap. I could go to the gym, and I'm not sort of trapped in my office environment where I would have to. Sometimes I can fold up laundry, but I like to be at home too. So I do hybrid, and I work 2.5 days from home and then 2.5 days from my office in town. So I think it helps with burnout. And again, like I've got the flexibility. Anytime someone is scheduled for an in-person session, I can just click a button on my telehealth platform and be able to switch into telehealth very easily. If somebody has bad weather, they're not feeling so great, or their kids are sick or something, then we can work from home. So those are the pros and one con. I don't know if anybody has any comments or if you want me just to keep going to the next slide. Okay. All right. So one of the biggest downsides to online therapy, and there's this huge debate over this on these mirror neurons. I don't know if anybody is aware of that we have human Wi-Fi. We have neurons in our brain that pick up on the person who is with us in a room, or I don't know if you've ever gotten a vibe from somebody, or if you pick up on someone's emotions. Some people are mood matchers. If someone's really happy, then we're happy too, or if someone gets really angry, then we want to join in and get mad. And we pick up on mirror neurons from others, and there's debate. I think we pick up on mirror neurons online, but some people say we don't. And just a little random fact, one way you can see if people have really good human Wi-Fi is you can yawn. If somebody has the urge to yawn with you, then they have mirror neurons. You're picking up on my urge to yawn. And another one, I don't really like this one because it's making me itch, and I only have chiggers on my legs. right now, but if I told you that I had lice and I was itching, then you might itch a little bit too, and that means you're tapping into me and what I'm experiencing. And I think that these mirror neurons are one of the biggest things for empathy that can exist. And I pick up on, I have a lot of them. So online, there's no difference to me on whether someone is processing something that I need to help them co-regulate and stay with them. I pick up on the human Wi-Fi online. Other therapists say that they don't feel it.
So co-regulation is how my behavior would influence someone else's.
Right. Co-regulation is my job. So if you're upset about something and you don't know how to handle it, there are things that I'm trained in as a psychologist, on my breathing, on the way that I'm holding the stress. I can take on by Wi-Fi what you're feeling, have empathy for you, and be able to help you know like where you're feeling that in your body, how we can calm that down. In when we're working on somatic things or also in cognitive behavior therapy. We take a lot on as therapists, but we're trained to know that it's not our problem. If I took on everybody's problems that I work with, I probably wouldn't be okay. But I can help calm people just by my presence. Um, yeah, privacy and space constraints. This gets interesting. At the beginning, it's really important that the first thing with your therapist is that you trust your therapist, and that you feel like you're safe. So, for example, I mean, I live in a big loft, so I'm in a big room right now. But on my first intake, I would show the person, and anybody would have a right to ask at any time. Um, just that there's nobody else in the room or that my window's open and nobody can hear. So we have this confidentiality and privacy and that it's quiet. Um, and so it could also be that the person at home has interruptions from their kids, or maybe their husband's in the next room and they don't want to talk about their sexual trauma before they met, or something that they just don't feel as comfortable as coming into a space. Yeah, and like I said, oh, I can tell you about my rural client, and he did not want anyone to know he was going to therapy, so he sits in his tractor. And so every week we do tractor therapy and we go through it, and it's working great. And he thought he was getting away with a big secret, but his wife was paying his copay, so she figured it out. But he likes to sit in his tractor and he likes to talk about his farm problems and succession problems and what do I do about this? And my parents wanted it to be this way, but now I can't do this. Like, we work out and problem solve a lot. Well, it's a pretty fancy tractor too, by the way. Nicer than my car. Um, so cyber safety is the huge issue. So if you use these big, and this is, and I'm going to stand on my pedestal here, it's kind of like the insurance companies are trying to buy all these platforms like Alma and Talkspace and Headway, right? And so the insurance companies are trying to dictate what types of therapy we can do. And they're also selling third-party information. So if you are going to do an online, they hit you before you start the therapy in the small print. And I have a lot of concern about cyber safety. I certainly wouldn't want my therapy sessions being uploaded to AI or being on some server somewhere that I don't know who it belongs to. So be careful about not non-HIPAA compliant platforms. They're out there like crazy, that they're gathering information. Some therapists are using AI notes, which means your information is being uploaded into some server somewhere. And so this is a big issue for a lot of private practitioners and people, just therapists in general. We promise safety and we promise that we're protecting um, your information and so that you can heal and talk about these things. And we just want to make sure that that's something to ask is, are you selling my third party, or read the fine print before you just click, because it seems the opposite of what we're trying to do if someone's collecting data and information. Yeah, I'm fighting that one. So, and I there are platforms available. Like I use one called Therapy Sites, and they guarantee that it's all super secure and nobody's selling any information. So another con is that there's, of course, technical issues. So internet can go down. That happened this week. I had to cancel everybody on Tuesday for my my appointments because the storm and the internet was down. Sometimes there's audio visual lags or the software is not working, and so it can, if we're interrupted during the session, it can stop the flow and kind of inhibit what's happening in treatment. Yeah, so I would say that also it's not suitable for everyone. If you have an autistic child who needs ABA therapy and needs somebody in there doing things, or occupational therapy to help them to learn things, and also some people with intellectual disabilities, they do better in person. And this is, there's been research on this too, that they need somebody there to make sure that they're safe and they're structured and monitored. Again, when we talk about some of these corporate type therapy entities, they are offering people 24 access to their therapist by text or just on-demand therapy. And you're not guaranteed that you get the same person, which I think isn't great. But also, as a private practitioner in my own business, there would be dependency and boundary issues if I can't. I typically have like a client load around 30 people, and if they were constantly texting me with their problems or wanting appointments on demand, I would not be a good therapist because it would get on my nerves, and I probably wouldn't be able to handle that or have a private life. And so, like Alma, Talkspace, Headway, some of these are requiring their therapist to be available 24/7. And I just think that's not fair. I don't know anybody who has a job that's just on call like that. And that it also, sometimes ethical practice, like we have to provide safety, security, but when we're at home, there can be distractions. If you forget, if you have a landline, to unplug it, or if somebody shows up at your house and you forget to lock the door, like we have to make sure that it's extra. You have to kick your husband out when when he's running late, because, and make sure that we're not distracted by anything that's going on at home. So that, and I think when we're sitting face to face with a computer, that we get into the same therapeutic modes, but it can be a little bit more distracting when you're at home. And so also I wanted to address the quality of therapists that are doing corporate online. They have super low reimbursement rates, sometimes up to 80% less than what you're going to get. So you're gonna, it's high demand on therapists. So you might get a burnt out therapist, and you might get somebody who's getting paid less. And this isn't, I don't think this is right, that there should be equity, that here the insurance companies who now own the platform for therapy, they're paying less to the provider, they're charging more to the consumer. And so I just want to say, probably you get what you pay for. So if you have an insurance and you can go to a private practitioner, you're going to make sure like I control my caseload. Some of the therapists that work for these large entities are required to see 10 people a day. That's a lot. I never see more than 6 people because I can't hold that emotion and hold that helping someone if I'm just like burnt out, and that's too many people. So you oftentimes, if you can find a therapist that's able to work part-time or to work full-time with a less of a caseload, you're going to get better service. Instead of people, I hate to say it, there's some therapists out there that are just going to cash grab and listen to you and not really work through and do evidence-based treatment. They'll listen to you, but it's going to make you dependent on them as well, because every time you have a problem, you're going to call your therapist. I personally believe that we need to train people to be their own therapists. I don't fix anybody's life. I just know all these tools that we can learn and apply individually to each person with their own treatment plan, so that they're able to go out there and use the skills that they've done. And I say everybody's an expert on their life. I'm just an expert on things that you can do to help you feel better. So I always say from the first session, we're going to talk about the last session. I'm going to teach you how to be your own therapist so that you don't need me anymore. Okay. All right. I know I'm talking had a lot of coffee this morning, so I don't know if anybody wants to jump in and make any comments, but we'll also have time at the end if you want to do that. Okay. All right. So some diagnostic assessments need to be in person, and I don't do diagnostic assessment. I do assessments like a general DSM-5, like what's the mental health disorders. But if you wanted a full neuropsychological exam and you have to do all the little tests with your hands on how to build things together and know what your IQ is, I would say if you really want a full neuropsych eval, you need to go in person, absolutely. Or if you're looking at autism, that has to be in person as well. And there's specific providers that work with autism and do just assessment, so you can do that too. But other than that, all evidence-based therapy can be done online. There's nothing prohibiting it. Even EMDR, I don't do EMDR, but it requires buzzers um, or lights sometimes where people are tracking while they're doing processing. And I have done the EMDR personally. Instead, I just used a tapping method instead. So I don't have buzzers and things like that too. So personally, when I went through EMDR, I just did the tapping instead of the eye movements. But yeah, there's no type of therapy that can't be done online. And then here I'd like to address crisis. Telehealth is saving lives. Absolutely. If someone is impulsively in that point where they're feeling suicidal and they don't have to get in the car or tell someone and drive somewhere, or they can just log right on and reach someone who's trained and who knows how to cope with people who are suicidal. And I guess I should say there's two types of suicidality. One is very common where people are having thoughts, intrusive thoughts, but they don't really want to do it. They're just scaring them. But they don't want to live anymore. They're thinking that things might just be better if they weren't a burden to people, and they have all these intrusive thoughts. And this is very common. Most people at some point in time in their life have an intrusive thought about suicide. But where we're saving lives are the people who are actively ready to go. Right. If they can get to me, or if they can get to another crisis therapist, and even if it's online, we can save lives. We can have 911 on the way. We can be talking to them and de-escalating and working on helping them find a reason for hope and live, and to stop that impulsivity. So they can get inpatient referrals can be done when we're online, and also the immediacy of care is just everything. I can't even say how much I love telehealth for this. And I think even Pawnee Crisis, at their Crisis Stabilization Center in Manhattan, they do all their screens online first, from when someone's in the emergency room or when they're at home, before they even admit them. Because we don't need to admit someone for inpatient stay if they're just having a bad day and they're mad at their husband or wife and they just feel like not living anymore, but they have no plan, or they're not going to do it, right? Okay. All right, so I add this on everything. I think this is a good resource for anybody to have. These are all the places that you can call if you know someone who's in crisis. And if you do ever encounter somebody in crisis, I would suggest that it's really kind of taboo in our society, but go ahead and ask them. If, are you having thoughts of suicide? Are you thinking about killing yourself? And if they say yes, then you're out of the danger zone. And if they're not, they're just going to say no. So I think that's a big way that we can help people, by just providing the hotline, and then call the hotline numbers. Team up and get to someone like me, or another therapist, or someone who's trained in crisis immediately. Because if you're not trained, you're going to freak out because you don't know what to do or say. Most people don't. So I thought I would share this with you guys. There's lots of really nice places to call, even a compassionate warm line. So if you're not suicidal, but you're just lonely, you can even call someone and they'll talk to you about what you're experiencing. And those are kind of after hours. Okay, so now I think I talked at you enough, and I guess I can open up the floor. And I don't know how much time we have left, but hopefully there's enough for some questions or discussion.
We encourage anyone to unmute or post a question in the chat. Sherry, I tell you, just your statement that telehealth is saving lives is striking, and the immediacy of being able to reach out to someone in the moment just seems very, very powerful to me. And I really appreciate you sharing that. You have a lot of experience with PTSD and our military families and those who serve. Any comment you'd make about PTSD and how that factors into this?
Well, there's so much weird stigma about PTSD, and the first one is that you have to be in the army or you had to serve in combat to get it. And I think that more pervasive, there's the ACEs study that the CDC did across the whole United States. I think there's almost close to 1 million people who they've studied now on the Adverse Childhood Experience Survey, and that complex PTSD from childhood trauma is more pervasive than anybody knows about yet. I mean, we're just starting to learn and treat that too. Um, so it's not just military, and also there, there shouldn't be a stigma either. People who have served and been to combat, like they're having a natural reaction to unnatural situations by having to go and do all these things. I mean, for example, like they're in the business of war. We know what they're doing when they're in war, but yet they come back and they have this cognitive dissonance. I'm sitting in church and 10 commandments say don't kill. Like, where am I? Or I don't want to burden things to my wife. I don't want to tell my wife. I don't want her to know what I did, or I didn't want her to know the things that I saw as far as like morally injurious. Like, you have to watch a lot of things happen that don't happen when you come home. And that I enjoy working with veterans. They're good soldiers. They do what they're told. They show up and they can heal once they get through the door. I think that the hardest part is for a lot of veterans is for them and to be honest, farmers are even worse. Admit that you can go and talk to somebody and say that there's a problem instead of just pretending like there's the elephant in the room, or I have to do things the way that they've always been done, and or even being able to admit I don't know what my future looks like. And that again, like the broken arm, if they had a broken, well, farmers might try to duct tape their arm shut first before they go to the hospital, but the same with veterans. Once you get in and you build, and I would say the number one thing is that you got to feel good around your therapist. Like it doesn't matter what modality they're doing, but the number one thing that we know is that if you feel safe and you feel like you can open up and you can build trust with someone who's an expert on how to help you, that it works. That sort of, at least we know in cognitive behavior therapies that 80% of people that go through a course of treatment come out in they'll be in remission for their PTSD, or they'll know how to handle it. So I think trying to solve it on your own is, I hear this too, like I'm a coward and I'm weak if I go to therapy. I'm like, well, you're kind of cowardly if you avoid it, and if you don't go and ask for help. Like, just go and get the help, and then your whole life gets better, and your family's life gets better, and your community life gets better. And I don't know, for some reason I keep having this idea that I wish I could go and to freshman high school and teach healthy relationship skills to every single one, and hope maybe that would carry on and help everybody in the whole wide world. But I don't have time for that.
Excellent. Yeah, boy, I can see it. In a way, it's taking that first step might be toughest for some of us.
It is, just to be able and also knowing that if you go in and you have a bad vibe on your telehealth session, or you don't really gel, that we therapists, we don't take it personally. I had somebody come in and did an intake, and he's like, "Oh my gosh, you look just like my mom." And I was like, "Okay, you're going to get another therapist, because that's not going to work, right?" Um, and different people have different needs, and I guess we're lucky in Manhattan. I didn't put this on here. We've got the mhkmentalhealth.org, and you can literally go in. We call it the Tinder. It's like Tinder for therapists almost. Like, you can go in and look at who's available, who takes your insurance, who specializes in what, when they're available, and just put in. You can say whether you want somebody that's based on race or based on their ethnicity, or you can just kind of pick what you want, and then see if they have people who's got an opening. And if you don't like your first therapist, just say what's going on. Don't keep going to someone that you don't feel comfortable with. Just, there's a lot of us out there. You can go and try somebody else.
Thank you for that. Any questions, comments? I am not seeing or hearing anything. So, Sherry, you've done a terrific job.
All right. Well, thanks for having me today.
Thank you. Well, we'll give you a virtual round of applause here, Sherry, and I'm seeing thank yous in the chat. So, uh, I really appreciate all you're doing and the way you're reaching and saving lives and improving lives for our people and families. So thank you very much, Sherry, and
Okay.
we wish you well and keep up your good work.
You're welcome. You guys all have a great day.
Thanks.
Okay. Bye.
So Remote Work Wednesday falls on the second Wednesday of each month. So stay tuned and watch for that announcement. Our next Remote Work Wednesday would be on Wednesday, July 8th. So be watching for that information. So for now, thanks again for joining us and have a wonderful Remote Work Wednesday. Good morning, everyone.